My name is Nitya. I'm from the pharmacy. I've been working in the pharmacy line. Just a brief introduction for myself. I've been working in the pharmacy for about 16 years now. I'm not that old. It's just that I started out early, hoping that I could retire early as well. Okay. I've been working in SGH for about 11 years before I came to Khoo Teck Puat before I came to AH in 2006. Then a continuous journey. I live in the west, so traveling to Khoo Teck Puat is always a big hassle for me in the morning. Okay, today I'm going to talk to you about a special group. This is pediatrics. Why pediatrics? Okay, back in AH, when we were in the A&E, I used to be working at night. Seeing a pediatric patient in AH is like very difficult. At times, in a whole month, probably just a few, or maybe less than 10. But now, today in KTPH, we see a lot of pediatrics. So it's very important for me to do this today. What I'm going to touch on is this. Why special care in dispensing pediatrics, medication error among children, and then special counseling points for medication administration. Babies we have to be very careful with babies, so the administration techniques for pediatrics is very special. Why special care? The development of pharmacology difference in pediatrics and adults. What I mean by this is pharmacology means it's a preparation, the effects and the uses of for adults and pediatrics is different. So we need to know that when we dispense medicine to this group of patients. Medications which are formulated and is also packaged in a different way for this group of patients. Lastly, our children cannot communicate to us, so it's very important that we're very careful. They wouldn't be able to tell us how they feel. Many of us have very big challenge. We have kids, we know we have big challenge in giving medicines to them. And this may lead to medication errors, which is the most important. Okay, the common prescribing errors, please bear with me, this is a bit wordy, but the thing is all the points here is actually very important. Inappropriate use of decimals. What I mean by is this. Sometimes instead of 7.2, they write 72.0. This means a lot. This is meals and this is meals. This happens. It's a lot of difference. Okay? Inappropriate or abbreviations. The abbreviations that they use is inappropriate. Okay? Individualized dose has to be based on weight rather than age. When we base on age, it's not actually very accurate. Weight is the most accurate because a 5-year-old child can have a weight of a 3-year-old, and a 3-year-old can have a weight of a 10, overweight. Wrong uses of the formulas. The availability of different concentration. They may not know, doctors may not be aware. Medications with more than one component. Some medications may be used for more than one purpose. Failure to recognize the older child had reached the cutoff dose. Some children may be 10, 11 years old, but they've already cut off the children age. So we have to give them, example, Panadol. Sometimes when we give 10 meals to a child who is 11 years old, probably if the child is overweight, then that's too little. Then you will see that, how come my child, the fever is not going down? Because the dose is too low. So that's not the right dose. And of course, drug allergy. Many times in pediatrics, we miss the drug allergy. We don't check, assuming the children would not have drug allergy, which is wrong. Okay. What a dispensing staff has to do in these cases is to double check with the common dosing for pediatrics. In our A&E pharmacy, we have this chart, which is actually a quick look for this age, for this weight, what is the doses. And this chart has been placed in all our doctor's room as well for easy prescribing. Double check with the dosage calculation. We have a special formula to calculate weight against the dose. Antibiotics must always be rounded up. In case if an antibiotic is 7.2, you cannot prescribe 7.2 because it's very difficult to syringe. So we will round it off to 7.5. It's always up, never down. It's not 7.0. This is wrong. This is the right dose. This is considered underdosing. So we need to round up. Double check on the patient's weight, age, diagnosis and allergy to make sure that whatever we give is the right drug, right medicine, right dose. Okay. If it's not clear, check with the doctors, intervene if the dose is not clear. Very, very, very important, never assume any doses. Okay, that can lead into medication error. Examples, fail to identify what we need to do, 5 R's. Just a quick one. What does 5 R's mean? 5R is right patient. I'm sorry, I've got very bad handwriting. Okay, right drug. Right drug. If it's a right drug, right patient, the next thing is right dose. The dose must be correct. If it's a dose, then the time must be correct. Then the route, it must be correct route. If it's by mouth, it's by mouth. If it's suppositories, then by rectum. So these are the 5 R's, which is very important. Odd doses, if the doses are odd, then change to suitable doses. If lack of suitable liquid formulation, then what we need to do is to look for alternative drugs. Okay. Division of doses, if the doses are difficult to divide, then we should always discourage doctors from using crushing. We should tell them we cannot crush or dissolve tablets. Inappropriate use of excipients. Preservative-free preparation should be recommended for children below 2 months. Okay, these are the common dispensing errors. Okay, what common administration errors we can do to prevent? We should supply microtubing, syringes or spoons and cups instead of. We should encourage parents to use this. Emphasize to them never use their kitchen teaspoon and measuring spoons because the calculation is wrong. Educate the caregivers on giving the administrations. Tell them how to do it. Make sure they understand. Like when you educate on the time of dosing, the route of administration. Okay, these are some of the common pediatric medicines we keep in the KTPH. Our store has helped us to bring all this because we never had this when we was in AH. Now we have this. Some more here. Some of the other medications may not be here, but we still, the adult version we can still give to children, but the dose has to be calculated accurately. Some take-home points to remember. Double check and ask the prescriber if unsure. The 5 rights. Communicate and educate parents how to supply. Just some pictures. Sorry, picture. Oh, this is a picture. These are babies from what happens when they go on overdosage. Okay. As a mother of 2, I myself am very careful with kids. Kids can be very cranky if they are sick. Lately, we had one case, not in this hospital though, this patient went back with the wrong dosage, came in for flu, but because wrong medicine was prescribed, the child ended up with having a urinary retention because of the wrong medicine. Yes, the child is I think only 3 years old, so we may not want our loved ones, this to end up to our loved ones. Okay, any questions? That's all. Yes.
Okay, just now you mentioned about the medication roll up to 7.2 to 7.5, right? So is it the same thing to the adults? Because you mentioned it's the pediatric.
No, for adults, the doctors will prescribe according to the tablets. Normally not syrup, unless if the patient is on NG tubing, if the tablets cannot be crushed, and they were to give, normally they will round up to the nearest 5.
Also, is like same thing like 7.2, for example, like Panadol. Something they order the liquid. So it's like just in case of 7.2, so you also rule up to 7.5.
We will recommend them to round up to the nearest 5s or the zeros.
Is it up or down?
For Panadol, no. As long as it's within the range, it's fine. It's only for antibiotic we need to round up.
Oh, okay.
It's only for antibiotics.
Okay.
Any questions?
Finish? Okay, well done.